Thank you for inviting me to speak. Dr. Jeffcoat and panel. My name is Markus, and I've been a general dentist in Philadelphia suburbs for 35 years since graduating from the University of Pennsylvania. There are 5 paragraphs in the handout that come below that I'd like you to read because the 4 minutes doesn't give me enough time to present that. Let me explain why we're here. Collectively, we are here because around 1830, MDs in this country advocated against the use of mercury in anyone's head because of the newly important technique of the use of dental amalgam. The blacksmiths and barbers, who also treated oral pain, therefore formed a guild whose support of mercury could today be compared with that of the ADA. The ADA has in its code of ethics the fact that it is unethical to speak out against the use of mercury fillings. Perhaps that is why so many dentists don't even bother thinking about the consequences of their continued use of mercury. Personally, I am here because my eyes were opened and my head came out of the sand when I read about the VIMI study performed in Canada over 20 years ago. Using a radioisotope of mercury in amalgams placed in sheep, VIMI sought to prove that mercury became inert. To his surprise, he found that it distributed to all organ systems, but crossed the blood-brain barrier much more than it distributed to the body. It crossed the placenta to an even greater degree. The Guild disputed those results, claiming that sheep were different than humans. VIMI's results were then repeated in primates. You, the panel, are here because despite the last panel's rejection of its own white paper in 2006, and the admission by the FDA's author of said white paper that the reason all the information presented to that panel was so one-sided and pro-amalgam was that he was only following orders. The FDA is under the influence of sinister forces that are trying to undermine health. Whose? I know both as a citizen and a dentist, the decision last year by the FDA not to modify protocols used, not just for the placement of mercury amalgam, but also to advocate for a safe removal process, smacks of corruption. The FDA asked me after the last time I spoke here what I thought about a ban against the placement of mercury fillings in the heads of children under 6 years old and in pregnant women. I told them it was a start, but it did not go far enough. All the teeth in the head of a child at age 6 have begun to fall out. So what the proposed regulation did was permit the placement of mercury fillings into the teeth that were going to remain in the body forever. They wanted to prevent its placement in pregnant women. I told them that the regulation should have begun at first menstruation, ended after menopause, and was also sexually discriminatory. So what the FDA did was nothing, the status quo. I've seen enough patients' conditions of depression, memory fog, Meniere's disease, fatigue, and more eliminated after the proper protocols are followed to remove mercury. I have seen others where the dentist acceded to a patient's request for mercury removal and their conditions worsened because proper protocols were not followed. The FDA had an opportunity to correct a 180-year-old wrong last year, and the powers that be succumbed to a 180-year-old sinister plot to poison Americans whose health is being compromised by a substance that 180 years ago was known by medicine to cause neurotoxicity. It's time for the FDA to right a 180-year-old wrong. Not only must this substance be banned, but the public and MDs need to be educated about the symptoms and correct removal protocols which must be followed. Only mercury-safe dentists should be doing this removal.
20 seconds.
How can I have any trust in government and any faith in the FDA when important decisions requiring simple protocol changes are not advocated by a government organization that is supposed to have the best interests of its citizens and not sinister lobbies at the forefront of their resolutions?
Thank you very much.